Hello and welcome to Cumberland Healthcare's Total Joint Education. The goal of our education today is to help you gain an understanding of what to expect during and after your surgery. We'll discuss our binder, we'll discuss discharge planning, discuss physical therapy expectations, and how to take care of yourself at home. Prior to your procedure, you will need to meet with your primary care provider to be cleared for surgery, as well to discuss your current medications, which medications you will need to stop before surgery, such as anti-inflammatory medications like ibuprofen or Aleve, or to stop blood thinners such as aspirin or Coumadin or Plavix. They may also explain to you how to take your blood pressure medications and diabetic medications the morning of surgery. Make sure you bring a list along with you the day of surgery. Flu shots need to be at least 2 weeks prior to your surgery. Next, if you have any flu-like symptoms, fever, runny nose, cough, sore throat, or achy a couple days prior to your surgery, please let your surgeon know. If you have been on any antibiotics 10 to 14 days prior to your surgery, please let your surgeon know ASAP, as this may postpone your surgery, as studies have shown that oral antibiotics can increase the risk of infection by changing the bacterial types in your GI system and on your skin. Call your surgeon's office if you have been scheduled on any scheduled antibiotics, as well as if you have any open areas or rash. Ticks are prevalent in the summer months, so be aware of this. Also, let your surgeon know if you have a history of MRSA, infection, or colonization. If you use nicotine, such as smoking, chewing, or vaping, you need to stop prior to surgery. This is because it can affect your healing, increase your rate of infection after surgery, loosen your implant, and lead to scar formation. With increased scar formation, there is an increased need for knee manipulation. There is more information on stopping nicotine use in the total joint binder provided. Also, so you are aware, we are a non-smoking facility, which means no smoking on our campus, as well as no chewing or vaping in our rooms. Your nutrition is just as important before surgery as it is after. So here are a few healthy eating tips. Eat fewer unhealthy fats, such as choosing leaner meats and more fish, trimming excess fats from meats, and using olive oil or canola oil instead of butter or lard when cooking. Limit excess salt intake, including limiting high salt ingredients such as soy sauce, bouillon cubes, garlic salt, and choosing lower sodium options when looking at food labels. Keep the salt shaker off the table. Limiting your sugar by swapping out sodas and sugar-filled drinks with water, cutting back on sugar in recipes, and choosing foods with less added sugar in them. Eating more fibers such as fruits and vegetables and increasing your water intake every day will not only help you with healthy eating, but will also help you with constipation following your surgery. There are also more tips that you can follow in the binder. It is ideal that you have any dental surgeries done at least 4 weeks prior to your surgery. It is recommended that you take antibiotics following this dental procedure prior to your orthopedic procedure. If you are needing dental work following your surgery, please talk to your surgeon first and discuss when you can schedule this dental procedure. If you have a metal allergy, including nickel, make sure you let your surgeon know as soon as possible, as our joint replacements are made of metal. If you do have an allergy to metal or nickel, you may need additional testing done, and it can take up to 3 to 4 weeks to complete, so it could postpone your surgery. Most people know at this point if they have an allergy to metal, whether it be from jewelry or watches. You will be receiving several phone calls from the surgical staff. The first will be a phone call from the pre-op nurse from Cumberland prior to surgery to discuss your allergies, including food allergies, your health history, such as do you have high blood pressure, diabetes, acid reflux, or back or neck problems, do you smoke or drink, or any other questions or concerns that you may have. They are going to discuss if you have an advance directive, and if you do, they will instruct you to bring it. A second phone call will be from a pre-op nurse the day before surgery to give you an arrival time and directions and verify that you have all the equipment you need and answer any last-minute questions. If you do not have an advance directive and it is something you would like, we do have the paperwork to fill out at our facility. You will also be getting a call from one of our pharmacists here at Cumberland. During the phone call, we are going to discuss and review any medications you take, whether they be over-the-counter, herbal, or prescription medications. You are going to want to have a list of medications ready with exact names, dosages, strengths, and how you take it, and the schedules taken ready and handy for this phone call. We do not need you to bring medications into the hospital with you unless instructed to do so by the pharmacist. On a very rare occasion, there may be a medication that we do not have in our pharmacy. The last phone call you will be receiving will be from one of our case managers. They will be going over many of the things we discussed today regarding your discharge planning needs. In preparing your home, you are going to want to make sure that you have a comfortable chair for after surgery that is not too deep or too soft and is high enough so that your hips are not lower than your knees. Feet can be flat on the floor when sitting in the chair. The chair needs to be stable. Main floor sleeping is recommended, especially if you have multiple stairs to navigate and you are exhausted. Although stairs are considered to be part of your rehab, it may not be the best thing to have too many stairs between you and the restroom or your bedroom. Making meals ahead of time, especially if you are the main cook in the home, will be very helpful for yourself and for your family. Rugs and extension cords are tripping hazards, and you are going to want to make sure that you have removed these from the walking area. In your bathroom, you may want to consider installing grab bars in your shower or tub for support as you get in and out, as well as handheld shower head. You can also consider using a shower chair in the shower, a toilet lift, or a commode chair if you have a 90-degree bending restriction to increase your height of your toilet. The height is different for every person, so you're going to want to measure your toilet at home and see how easily it is to get on and off. A rule of thumb is that if your hips are slightly higher than your knees, that is right. Please reference the optional equipment section in your binder for examples of these items. Another item that might be helpful for you to purchase are bag baths or bag shampoo, as it may be 3 to 5 days before you are able to shower after surgery. Preparing yourself for discharge. Let's start discussing this now to make sure that you are ready. In order to have the best outcomes, it is important to arrange transportation for after surgery. You will need someone to drive you to and from physical therapy sessions, your follow-up appointments, lab draws. So consider that you are going to need somebody to drive you around. We can help you get a handicap permit if needed. We can give you them at the time of discharge or after surgery. You will need to finish filling out the form, and then it can either be mailed into Madison for about $6. Otherwise, you can take it to your local DMV for about $9. Pillows are nice for transportation home, as it may be more comfortable for your ride. It is nice to have somebody help you at home for the first 4 to 7 days following surgery, as you may need help getting in and out of your chair, bed, or taking a shower, or even grabbing your medications, or if you need somebody to fill up your ice machine. We recommend for at least the first 4 to 7 days, but it really is up to you and how your health and confidence is after surgery. If you know you'll need assistance, let our case manager know, and we can discuss this during discharge planning. You will need a copy of your ID and insurance card, some comfortable clothing, as you may want to put some clothing on right after your procedure. So consider clothing that is loose fitting and easily can go over your dressing. Jeans are not the best for after surgery, or even tight yoga pants or leggings are not recommended. Please wear your glasses, hearing aids, and your dentures. Make sure to wear clean, comfortable shoes that are easily slipped on and off, and that will prevent you from slipping. We do have slipper slacks and robes available for while you are here at Cumberland. Please bring in crutches, walkers, personal care items. If you have a CPAP, etc., please bring things like that. If you do not have any equipment, you can borrow from friends or rent from various vendors. Look into the back of your binder for a vendor list and that equipment that will be needed or optional. Physical therapy also recommends a front wheel walker, not a four-wheel walker with a seat, as it is less of a fall hazard. Leave valuables at home, such as jewelry, wallets, etc. We don't want to have to worry about misplacing those. And if you do have an advance directive or living will, please bring it along with you. There is a checklist in your binder for what you want to pack for the hospital. So that's including your comfort items as well. 2 days before your surgery, you will start using the cleansing kit provided, and just follow the instructions provided. When showering, you will wash your hair and face and your genitals with your normal shower soap. Once that is done, you will take the first sponge and 1/3 of the solution and scrub from top to bottom, starting with your shoulders, working your way down all the way to your toes, doing front and back as best as you can. Let that scrub sit on your skin for 60 seconds and then let it rinse off. You may need some help with this, especially getting your back. Once you are done rinsing that off, you will dry off with a clean towel and put on clean clothes. No lotions or powders after you are done with the first wash, and no shaving under the arms or legs for the 4 days prior to your hospitalization, as it can open areas and increase your risk of infection. Now, the day before surgery, following the instructions given to you by your physician and pre-op nurse about when to stop eating and drinking, please follow these instructions. This also includes no smoking, chewing gum, chewing tobacco, or vaping, or sucking on any lozenges. Take a second shower, the same as before, washing your face, hair, and genitals with your own soap, and then using the second sponge and the second third of the solution, and let it sit on your skin for 60 seconds again. Rinse off, dry with a clean towel, and put on clean clothes. Again, no lotions, powders, or shaving. This is the night that you should remove all your jewelry, piercings, makeup, nail polish. If you have any acrylic nails, make sure that you have one free nail, as well as no toenail polish on. We are now to the morning of your surgery. So again, shower, washing your face, hair, and genitals with your own normal soap. And then use the last of your cleansing kit, so that last sponge and the last third of the solution, washing from your shoulders down to your toes, front and back, letting it sit for 60 seconds, and rinsing, drying off with a clean towel, and putting on clean clothes that are comfortable to wear to the hospital. It's okay to brush your teeth, just try not to swallow any water. If you have any medications to take that morning of that are cleared by your provider, make sure you follow those instructions and which ones you can and cannot take, and take it with the smallest sip of water that you can. Do not apply any makeup the morning of surgery, as it can harbor bacteria. Once you arrive to the hospital, we highly recommend you arrive on time. If you are running late, please call ahead using the number in your binder and follow the directions given to you on the day of your surgery before of where to go. The pre-op nurse will come and retrieve you and bring you to your pre-op bay, where you will be changed into a hospital gown. Compression stockings will be applied to your non-surgical leg. You will also will go through your medical and surgical history, along with any allergies you have, going through pain management and asking questions at this time. Consents will be signed, your IV will be started, labs will be drawn, and the surgical site will be washed. If we do need to check your blood sugar and we see that it is over 180, there is a large chance that your surgery will be canceled due to uncontrolled diabetes affecting your body's ability to heal. Once this is done, your surgeon will have ordered medications to start being administered prior to the surgery. So we will start giving those to you with a little bit of water, as well as through your IV. The medications given to you during your pre-op surgery and post-op can be reviewed on the medication section of your binder. Once this preparation is complete, anesthesia will visit with you and discuss medications utilized during the procedure, as well as administer a nerve block if ordered. The surgeon will also visit with you and answer any questions you may have for your surgery, as well as mark the surgical site. Once this is all done, the surgical nurse will bring you back into the operating room. This room is filled with numerous people, such as nurses, anesthesia team, surgical technicians, X-ray technicians, surgeons, and the nurse practitioners and physician's assistants with your surgeon. Your surgery generally lasts about 2 to 3 hours. After the surgery, the surgeon will notify your family about how the surgery went. After the surgery and the surgeon notifies the family, it does not necessarily mean that the patient has reached the recovery room quite yet, so just keep that in mind. The recovery room takes approximately 2 hours for the patient to be in, but it could be a little bit less depending from person to person. There may be a need for supplemental oxygen given either a mask or a nasal cannula. This may help clear the anesthesia out of your lungs. Do not be surprised if you need oxygen on and off for the first 24 hours following this procedure. There are no visitors in the recovering room, and pending the hospital policy at the time of surgery, visitors can be in the inpatient unit. Due to anesthesia, you may not remember the recovery room, and we will update your family upon arrival to the inpatient unit. Once you have been admitted to the inpatient unit, we ask that family and visitors give us 10 to 15 minutes to get you settled and do your assessment. We ask that you keep your visitors to a minimum to allow for your rest and healing. We will have an on-call provider assigned to you that will help manage your different health conditions such as blood pressures or blood sugars. You will also have a physician's assistant or nurse practitioner that works with your surgeon that will help manage your care. Once you are in your room and we have you settled, we are going to have you start doing ankle pops, where you start moving your ankle back and forth, flexing and pointing. This helps increase circulation and helps prevent blood clots after surgery. We are also going to encourage that you take deep breaths and cough often to help expand lungs and prevent pneumonia following surgery. We also have you use an incentive spirometer following surgery. It is a device that can measure how deeply you inhale. You suck in like a straw. We will have you do this in the pre-op bay and measure what you can do before surgery, setting your goal for after surgery. This is something we want you to do independently after surgery about 10 times every hour. The nursing staff will check to make sure that you have been working on this. No matter what anesthesia you use, it causes your lungs to be a little sticky, so coughing and using the incentive spirometer helps open up your lungs and expand those airways. You will be starting on oral fluids depending on how you feel after surgery. We will then gradually progress your diet depending on how you are tolerating. We advise you to go slow. In your room, we will want you to be active. We will want you to be moving around within the first 4 hours following surgery. Usually the goal is 150 feet from the first ambulation. Early ambulation helps with the healing process of the implantation and helps prevent blood clots. Be prepared to get up into your chair for all meals as it is an order per the provider. You will be wearing your own clothing the following morning or whenever you are ready to put them on. Constipation is very common following surgery due to anesthesia, pain medications, and alterations of diet. We do start you on stool softeners pending on your physician order. More information will be in the binder on these medications. We do want you to continue taking those at home, especially when you are taking those pain medications. Drinking fluids or 6 to 8 glasses of water a day helps with hydration and preventing constipation, as well as increasing fiber, which we will discuss more later. Urinary catheters are usually removed right after surgery, or your surgeon may not even have one inserted. In rare cases, a catheter may stay in for the inpatient unit. In most cases, it will be removed and you will have to notify the nurse when you need assistance to the bathroom. Other equipment that may be in your room will be a sequential compression devices or sleeves that go over your calves and help pump blood, preventing blood clot formation. Whenever you are in bed, we will have these plugged in. We do encourage ambulation, and when ambulating, they can be removed. You will also have compression stockings on or TED hose on your non-surgical leg. These also help prevent blood clots and swelling. Oxygen therapy will be with a nasal cannula, and as I said earlier, if you have a CPAP machine at home, please bring that as well. The IV that was started in the pre-op bay will stay in your arm or hand until you are ready to be discharged. You will have IV fluids running for approximately the first 24 hours and receive antibiotics through your IV to help with healing and prevent infection. It will be discontinued when you are drinking plenty of fluids. The IV will be removed on the day of discharge. The other thing that may be inserted is called a drain. This will be near the surgical site and it will help prevent any swelling from drainage. It will be removed by the nursing staff or on a provider order. Each patient will be started on a blood thinner specific to them based on the procedure and health history. If you are on Coumadin, it does require lab draws and you may be required to continue those lab draws. Your dosages may change and more education will be provided once your blood thinner is decided. Our goal is to keep you as comfortable as possible while monitoring your activity and your tolerance. We will discuss with you various methods of pain management that will help keep you comfortable. Each patient has different levels of pain and tolerance, so it is important to discuss what is tolerable with your nurse. You will not be pain-free following surgery, but we need to find what level you are comfortable at and will be able to function with. This can be done with medications as well as cold therapy, comfort items like music, movies, books, anything that is relaxing to you. You will be participating in physical therapy with exercises that they will teach you to increase your strength and mobility as well as walking. Usually, most patients are weight-bearing as tolerated with an assistive device. Occasionally, this may change, and we will discuss this with you if your provider does order this change. You will be starting physical therapy as early as the afternoon following your surgery or the morning after. You will be expected to walk to the bathroom and in the hallways with your nursing as long as you are feeling well. Physical therapy will educate you on your ADL items and they can assist you in your daily activities. They will assess you in your activities and determine which item will be of most benefit to you and dispense items based on this assessment. Our goal is to assist you in returning home. Discharge planning starts now. Our care team reviews your progress and makes decisions on what is best for you. If it is decided that you need a rehab stay following, we will help you find a rehab facility, but understand that insurance coverage varies based on certain medical requirements. Most patients will go directly home. Our case manager will work with you, the rehab facility, and your insurance coordinating care. They can aid in home health services as well. Always be prepared for a backup plan if things do not progress as they should. Even though you may have a skilled nursing facility rehab benefit, it is not guaranteed that insurance will approve a rehab stay. So this may mean that you need to have someone who is willing to help care for you at your home as a backup plan. We do have some patients who qualify to be a fast track patient, which means that they have gone through some preliminary checks such as physical therapy and have everything set up at home and have had a lot of education done prior. These patients still go to the inpatient unit following the procedure, do physical therapy, and then go home the same day of surgery. If for some reason they are not ready for discharge, they will be discharged the next day. Your care team will decide when you are ready for discharge. It is helpful if the person who is going to be helping you at home is your driver, so they can be educated on care for home as well. For follow-up appointments, we will discuss the various appointments we have scheduled for you, such as lab work for blood thinners, physical therapy, and seeing your surgeon. Physical therapy will be there 3 times a week as ordered by your surgeon, and you will see your surgeon in about 2 weeks following your surgery. During the day of discharge, we will have multiple people going through discharge teaching with you. A lot of it will be repetitive. Medications will be reviewed. Physical therapy will discuss exercises to do at home. Cold therapy will be reviewed, and how to change your dressing. The nursing staff will provide education for you and the person to help you at home. We highly encourage that this be the person who is driving you. Let's now discuss your care for yourself at home. Starting with your TED hose. You will wear them in the morning and take them off at night. We encourage the use of the sock aid to help put these on. Do not wash them in the washer or put them in the dryer. Hand wash them and hang them overnight. We send you home with one set. It is usually only 2 to 4 weeks that you are expected to wear them. In controlling your discomfort at home, you may need to use pain medications. Remember to try other things as well, such as cold therapy, distraction, and comfort items. We do send you home with a cold therapy machine. You may want to have frozen 4 small water bottles ahead of time that will save you on ice at home. This machine only needs to be plugged into the wall to turn on. You put in your ice or your frozen water bottles and fill the water to the fill line and shut the cover. There is a tube that connects the ice pad, and you can attach this via Velcro to your surgical dressing. We encourage you to use the ice pad only for 30 minutes at a time. If your leg gets too cold, it can affect your circulation. We do review this at the hospital. As stated before, blood thinners are prescribed for you after surgery. No matter what kind you are taking, it is important to take them at the same time every day. Do not stop taking them unless directed to do so by your surgeon. We will discuss this further when you are in the hospital once we have a prescribed blood thinner specific to you. With Coumadin, there will be a twice-a-week lab draw. These results will be faxed to your surgeon's office, and they will notify you if your dose needs to be changed. Once you go home, you will have a daily dry gauze dressing change. You will be sent home with the dressing change supplies, so you do not need to worry about purchasing these ahead of time. The kit includes 3 tubs of dry gauze. The nurse will go through the dressing change prior to discharge. There will also be picture instructions in your binder. When you are doing the dressing change at home, it is very important to wash your hands prior to removing your dressing. When you are doing your dressing change at home, it is very important to wash your hands prior to removing your dressing. The dressing is a simple 2 pieces of gauze and tape that is removed. There will be steri strips that cover your incision. These are to be left alone. Check the incision for signs of infection, such as redness, swelling, yellow or gray drainage. You will wash your hands again, and you will then replace the dressing of 2 pieces of gauze and then tape back on. If you have any signs of infection, please let your surgeon know. Proper nutrition will not only be helpful for your healing process, but will also help your constipation. This can be caused by anesthesia or pain medications. It is important to get enough fiber and water. Please see your binder for fiber recommendations. Limiting processed food and refined foods such as fast food, deli meats, pizza, bacon, fries, etc. will help prevent constipation as well. It is important to have protein with every meal to help your healing. This includes meat, fish, poultry, beans, eggs, dairy, nuts, and seeds. Fruits and vegetables are good options for fiber. Swap out dessert with fresh fruit and add vegetables to your sandwiches. Some frequently asked questions are, when is it okay to shower? Each provider has a specific time that will be given to you on the day of discharge. It should be a brief shower and you will get wet, but do not scrub your incision. And make sure to pat dry following with a clean towel. What is your knee made of? Most are made out of poly, cobalt, chrome, ceramic, or titanium. It is very dependent on each person, and it will be something that you will want to discuss with your provider. Are you able to kneel on your total knee? This is something that is okay to do. You will want to have something soft first for the short period of time, and it will take about 3 to 6 months before you will really want to kneel on it. For traveling, make sure you ask your surgeon for when it is safe. The security should be notified of your joint. It may set off the metal detector depending on their sensitivity. When you are on the plane, you should try to get up and walk as much as possible, do ankle pumps, and wear TED hose. Opt for seats with more leg room so that you can stretch. Here is an X-ray of what the component looks like inside, just so that you can see. If you have any questions, please feel free to reach out to us. Our phone number is listed here. It is also listed in the binder given, along with the surgeon's phone numbers. Good luck in this process.